work a lot with kids and teenagers with some type of brain injury, whether that's acquired or traumatic brain injury, or maybe a brain injury from a condition like epilepsy. And some of the presentations most often that we see are very similar to ADHD or even to autism. It's kind of important to differentiate what symptoms were present before the brain injury versus developed secondary to the injury. The approach is somewhat similar. We definitely still use executive functioning type training for our TBI kiddos, but there are some key differences. One of the main strategies we use is teaching how to problem solve independently, because that comes in handy across the board. And very importantly for TBI, especially if it's a more severe TBI, there will be a need for not just a rehabilitation approach, so trying to regain the lost skills, but also like compensation type approaches. So how can we compensate for the loss of ability in a particular area that the kid is working in? So for TBI, just like for ADHD, we utilize parents quite a bit, because when kids are discharged from the hospital or from the inpatient rehab unit, that's where they go. And so it's really important that there are environmental modifications to support the child. And then you can be followed by either neuropsychology or psychology to support ongoing recovery, learning, and adapting strategies as the child ages.